Hi, everyone. We're so glad you're here with us today. Welcome to today's program on how to improve the coverage that you have of food insecurity in your community. We are so glad that you're making the time to be with us today. I'm Beth Francesco with the National Press Club Journalism Institute. We're so glad to bring together 4 phenomenal journalists for this important conversation around food insecurity. We do have a live transcription, closed captioning option available during the program. If you're joining us on a desktop or laptop computer, you can enable this at any time by finding the CC live transcription button in the navigation menu. You can click on show subtitle and that closed captioning will begin. You can also disable it at any point by clicking hide subtitle. We'll be recording this program and a link to the video will be emailed to you. So if you miss anything, don't worry, you're going to have a chance to catch it a second time. Highlights from the program are also going to appear on our website and in our daily newsletter with the video. If you haven't already subscribed to our daily newsletter for journalists, you can do that now. This program is designed as a conversation, and we hope that you're going to join in with comments and questions. Please share any questions anytime in the Q&A queue. We'll be monitoring them and responding later in the program. And it is now my honor to introduce this program's moderator, Karen Robinson-Jacobs, investigative reporter on the public service journalism team at Lee Enterprises. Karen has reported extensively on food insecurity as part of her work, including for the Report for America's Barren Mile Project. We couldn't be in better hands. Karen, over to you.
Thank you so much, Beth, and thank you so much to the National Press Club Journalism Institute for hosting this discussion on a really important topic and a basic human right. I am Karen Robinson-Jacobs, and I'm really glad to be here today. I have covered food mostly from the standpoint of retailing for the past 16 years, first with the Los Angeles Times and then with the Dallas Morning News. And as Beth mentioned, took really a deeper dive when we looked at the Barren Mile. When we started the Barren Mile Project, it was part of a team effort of Report for America and 4 Black-owned newspapers. And the link is now on the Ground Truth website. So if you want to go back and see that. So I am thrilled to be joined today by really, really stellar journalists who are very dedicated to the food space. And we're going to start with Alejandro Figueroa, who covers food insecurity and the business of food for WYSO, also part of Report for America. And he especially focuses on food access and lack thereof in Southwest Ohio. Alejandro, tell us a little bit more about your food journey.
Hey, thanks, Karen. It's an honor to be here and be talking about this. And like Karen said, I am the food insecurity reporter at my station, WYSO. It's a little tiny public radio station in Yellow Springs, which is in Southwest Ohio. And I've been doing this Report for America for about 1.5 years. And throughout that time, I've been looking at sort of the lack of access to healthy and affordable foods in Dayton. So Dayton's really, even though we're like outside Dayton, like in the village, we cover the metropolitan area predominantly. And Dayton has been a city that for decades has been segregated. There's the west side of Dayton, and it has been, historically invested in and, red line. And so there's this huge need for resources, both community resources and government resources. And so I've been looking at what both nonprofit agencies and government have been doing to address some of those food inequities in some of those communities. And I've also been covering, how COVID and inflation has impacted my local communities over here. And yeah, there's a lot of things that you can do. Food is such a broad topic, right? So I've been looking at all those things.
Fantastic. And we're actually going to come back and talk a little bit more about some of those, drill down a little bit more on some of those topics. Next, we have Bridget Huber, who is a staff writer with the Food and Environment Reporting Network, also known as FERN. She has received grants, awards, fellowship from the Pulitzer Center on Crisis Reporting, UC Berkeley 11th Hour Food and Farming Journalism Fellowship, and Mesa refugee, among others. Bridget, tell us what sparked your food journey.
Thanks, Karen. Hi, everyone. I'm really happy to be here. I guess I've sort of reported on different aspects of food and the food system. I certainly think the social element is really important, and looking at people and communities and how, federal policy sort of shapes people's lives. I have approached it from an environmental sort of perspective, looking at, issues of climate, biodiversity, so public health, like a lot of different lenses. But where I work, Fern, it's a nonprofit newsroom based in DC, and we do take a pretty broad approach to food systems. But one of my beats is definitely food insecurity. And we publish with national news outlets. We publish our features with national news outlets, and we also produce a daily newsletter called Ag Insider that has shorter pieces that follow policy pretty closely. So I'm always kind of trying to both follow policy and then, take on sort of larger feature projects that dig more into the issues and kind of get into context and how people are living through these experiences.
Absolutely. And again, we're going to come back and talk about those a little bit more. Rounding out our panel, we have Lauren Lindstrom, who is an independent journalist focused on housing and health. And she is an O'Brien Fellow in Public Service Journalism at Marquette University in Milwaukee, Wisconsin, where I also used to work, and also part of Report for America. And she focuses on health, housing, and food. So Lauren, tell us a little bit about some of the things that you focused on in the food space.
Yeah, thank you, Karen. So I think my journey into food reporting came through the beats that I've spent most of my career on, both at two previous newspaper jobs in Toledo and Charlotte, North Carolina. And that was health and housing. And it's really impossible to spend any amount of time covering either of those beats without food sneaking its way in, sometimes without even realizing it. And so, so many of the stories I was writing about inequality, about access issues, about disparities, whether that's in life expectancy, quality of life, chronic illness, homelessness, all these kind of big, broad topics, it was inevitable that either lack of access to healthy, nutritious, affordable food was either a driver of the problem you're talking about, or the problem you're talking about creates, bigger disparities in food access. So it's a little bit of a chicken and the egg approach to reporting of, is food the driver or kind of the outcome of some of these big systemic problems in health and housing. And so for me, it was just a good reminder that, despite the fact that we think about beats as kind of these singular things, oftentimes it's really impossible to separate these issues, and food for me always came up, just in almost every story.
Absolutely. Absolutely. And a little bit later, we're going to talk about some of the non-obvious food stories that may cut across different beats. When I, sorry, full disclosure, my allergies have chosen this moment to start attacking me, so I apologize. When I started working on the Barren Mile project, which was really a look at the impact of COVID on food access, food insecurity, different steps that were being taken across the board, nonprofits, government. We started with the basic definition of what is food security. And that is the regular, consistent, convenient, affordable access to levels of nutritious food needed for a healthy lifestyle. And so that is, that's kind of the textbook definition. Generally, what it boils down to often is access to a traditional large-scale grocer within about a mile. Residential areas that fall outside of that parameter were formerly called food deserts. And that was a popular term. I've found it dating back to the 70s and 80s. Now the USDA has changed the terminology. They use the very lyrical low income, low access, which just rolls off the tongue. But that accounts for an estimated 20% of Black households. And I've seen estimates of between 17 and 23 million residents nationwide, which is really kind of a staggering figure when you are talking about something that is a basic human right. And so when we began reporting, it became clear that these areas of low access were not naturally occurring like a desert. They were the specific result of, in many cases, decades of neglect and structural racism, beginning with, Alejandro talked about redlining, beginning with redlining, which not only saps the ability of the consumers to have access to funds that people in other communities have through their housing. The housing is devalued, but it also makes every construction project in those areas a lot more expensive, which makes it harder to make a profit, which feeds into the narrative that retailers don't go here because they can't make a profit. And so what we try to do is really look beyond just why isn't there a grocery store here, and really look at some of the structural things behind it. And so one of the things that we wanted to do today was talk about some of the less obvious angles of food insecurity and food access. So one of the things that food activists are doing now is to focus on some of those structural racism issues. They have used the term food apartheid, sort of hearkening back to South Africa and their system of racially based oppression. Whether or not you agree with that term, clearly this is a much bigger story than, you know, where there is or is not a grocery store. So I want to start with Lauren. Talk a little bit about why the coverage of food access and food insecurity needs to go beyond that question of, you know, where is there a grocery store here or there?
Yeah, you know, I loved what you said earlier about the definition being not just, you know, the access to food, but that it's affordable, that it's nutritious, and that it's a consistent, you know, that you can consistently get it. Because yeah, I think a lot of the early framing has been, you know, this many miles from a grocery store, there's this many corner stores compared with how many grocery stores there are. But for a lot of people, you know, it might not be actual proximity, but it might be whether they have the transportation to get there. We know so many cities have built it in a way that without a car, you really cannot get around reliably. Or maybe it's the fact that the grocery store could be down the street, but if you can't afford the food that's in there, it doesn't do you a whole ton of good to have it, you know, in your backyard. And so I think when we talk about food insecurity, it's while access to grocery stores is a huge component of this, because obviously it gets harder the further you are away from a grocery store. It's an economic development issue, it's a jobs issue, and a wages issue, right? So access is one thing if you can look at it, but if you can't like actually get to the finish line and buy it and purchase it and have, you know, a kitchen where you can prepare healthy foods and store healthy foods and, you know, have a safe place to do that, it becomes oversimplistic as that being kind of our major marker, because I think it goes into so much more of that, and it's just one facet of why someone might not have access to regular healthy food.
And thank you so much. And you talked a little bit about health consequences. Bridget, I know that during the pandemic, there was a lot of discussion about how a lot of chronic conditions that were seen in specific communities made people more susceptible to very negative outcomes from COVID. Talk a little bit about the intersection of food access, food insecurity, and COVID.
Sure. that's, I think that was one of the most kind of troubling things that the COVID pandemic laid bare. It's not something that I reported on a lot personally, but I mean, I think that, the argument was very strongly made that, yeah, having lacking access to healthy foods, having chronic conditions certainly made people have much worse outcomes if they did contract COVID. I think also another piece of it, that ties into this need to be looking at these issues much more broadly is, looking at how economics really determined, who was able to stay at home, socially distance, protect themselves and their families, and who, didn't really have a choice and was, out on the front lines, or, in our grocery stores, that it was not just random, the way that COVID affected communities. And I think that, the pandemic, a lot of interesting things happened because so many people experienced food insecurity for the first time. At the same time, food insecurity was a problem in America before the pandemic, and it will be, once things go back to normal. I think one of the differences is that, the government really responded and put into practice this sort of broad suite of safety net programs. And we had a robust safety net for a period of time in this country. A lot of those measures that were most effective were actually, really anti-poverty measures like the expanded child tax credit. So I think now the question moving forward is like, how do we learn from some of these lessons that we learned during COVID about, the economic, the importance of, wages, of making sure people have just money in their pockets to really work on a lot of these issues, and strengthening the social net, making it more effective.
And one of the things that was most interesting to me was how the negative outcomes played out in terms of different communities. I know that initially, most of the most serious outcomes were among the elderly population, but it pretty quickly shifted to people of color, large segments of people in specific food industries like the meatpacking industry, tremendous impacts there. And so all of that falls under the category of, food access, both from a supplier standpoint and from a consumer standpoint. And Bridget made that excellent point about the safety net that was expanded during COVID. I know, Alejandro, you've looked a lot at some of the actions that have been taken around this from the federal standpoint. Talk a little bit about kind of some of the things that you're seeing.
Yeah, so like Bridget, had mentioned, we all know this, right? Like the pandemic really highlighted a lot of those gaps and shortfalls, that the federal government is now, and they have been, sort of looking to address. And of course, like a few weeks ago, the White House brought together, anti-hunger advocates, farmers, and policymakers to talk about stopping hunger in this country. And then, that same week, the White House published its like national strategy on hunger, nutrition, and health. It's a really ambitious, very detailed plan that involves like federal, state, and non-government agencies and private companies on initiatives to end hunger by 2030. Like, that's very huge and ambitious. And I think the, interesting thing about it is, because it involves so many organizations. The big question as a journalist, I think, is how do those initiatives reflect locally, and how do you hold like these agencies and government offices accountable for what they said that they will do? Like, an example is like DoorDash. They announced that they will partner with 18 cities across the country, so that community-based organizations like food pantries can deliver food to their clients for free. The American Academy of Pediatrics said that by 2030, it will offer training to all of its members, like all of its pediatrician members, on how to screen patients for food insecurity and referring them to, community resources like food prescription boxes, if you know what that is. And on top of that, the White House government is now looking to increase like SNAP benefits and, more community resources to underserved communities and expanding free school meal access. So there's a lot of things that are going on federally that has been on the radar of a lot of policymakers. The question is, how does that impact local communities?
And this is for all of the panelists. Are you seeing a lot of action both at the state and local levels around this issue? And I know I spent the last year in Missouri. Does the approach in the state depend on whether it's a red state or a blue state?
I have a couple of thoughts on that. One story that I reported a few months ago looked at the expanded SNAP benefits that were put into place during the pandemic, which were an enormous help for a lot of households. States can still offer those benefits to people, living in their state borders, but some states have started to opt out effectively by, declaring an end to the public health emergency within their state that let them tap into those extra benefits. So there, you see an example of states often, these are, I think all the states that have done this so far are red states that have, basically made a decision that has left, thousands and thousands of people without the extra benefits that they could have had. The other thing that I think is interesting is looking at school meals. So, another part of the government response to hunger during the pandemic was to make school meals universally free for all public school kids. The waivers that let that happen were not renewed this spring because Republicans in Congress opposed them. So, most schools in most states are back to the status quo of having kids either pay or, sign up for free or reduced lunch. But some states have decided to continue feeding all kids, and California and Maine have made meals permanently free. A handful of other states have made them free for this year. A bunch of other states are considering legislation to move toward universal meals. So I think that's a really interesting example of kind of how, this federal policy, even if it's not in place anymore, is having this echo in states and in local communities.
But it seems like it's kind of spotty, and your access is going to depend basically on where you live.
Yep. And that's, I think that all the anti-hunger folks that I've talked to consider that to be a real missed opportunity because, of course, especially when we're talking about anyone, but especially with children, like, whether or not they get something that they need based on their zip code seems, pretty hard to accept.
Exactly. So we talked about food access as obviously a political story, what's happening depending on whether your state is red or blue at the federal level. And I think that shows that food access, hunger, food insecurity, all of these things go beyond just a single beat. I know that I looked into food really kind of as a transportation issue, and I know somebody mentioned it earlier, as a transportation issue. If there is a grocery store, many consumers in low income, low access areas don't have regular access to a car or don't have a car that, always runs. If there are no sidewalks between them and the main street, if there is no public transportation on the main street, that then becomes a transportation issue that becomes a food access issue. So talk a little bit about, Lauren, we talked a little bit about kind of the health implications of food insecurity. Drill down on that a little bit more beyond COVID. So once we're past COVID, will we still see this kind of nexus between health and food access?
I think we absolutely will. I mean, it's interesting because there are really natural places that I think doctors in the healthcare community have understood the connection between food and health, right? Whether we're talking about chronic illnesses like diabetes and high blood pressure, where there's such a easy line to draw between, you know, what someone is eating, what access they have to food, and their outcomes. I think that but it goes so much deeper than that. And I think it's a really interesting path to look at a reporting path to look at the healthcare system and their kind of slowly evolving attitude toward how much food and food insecurity is a priority within their care plans, within their funding, within how they prioritize initiatives. You know, it's been a couple years, but I remember the first time, you know, I wrote a story that a hospital system in Toledo was putting a food pantry in a hospital, right? And doctors could send someone there immediately after their appointment because they added a screening question that said, you know, have you worried in the last 2 weeks, month, whatever it was, about food running out, about your access to food. And, you know, it was kind of brought out as this feel-good feature story of we're now adding this program and all these things. But I would talk to doctors who say, you know, we've known this forever, right? That our folks aren't getting what they need, but the system hasn't really caught up for us as providers to like have any leverage in that place beyond telling you, you should be eating more vegetables, you should be eating less processed food to manage your diabetes, but we didn't have the tools to, you know, refer them to a food bank, do all these things. And I think slowly, very slowly, our healthcare system is catching up to some of these, you know, what we call social determinants of health, right? All the things that affect your health that are outside the four walls of the hospital, the environment you live in, right? How much education you have, all these things that I think on a gut level, a lot of healthcare providers and public health workers and all these folks kind of knew, but there hasn't really been a mechanism for them to directly, you know, help folks. And so I really think that's an important thing to be tracking through a health lens is, you know, are we following through on what we know the science says about the importance of health access, you know, food access and healthy foods. But is that actually like happening in practice? If you as a doctor are coming, have a patient, like what can you do other than telling them you should be eating less sodium and more veggies, but like, you know, they don't have access to it. And so, you know, I just think like, as Alejandro said, like keeping these systems accountable, you know, are you following through with what you say is important and where are the barriers, you know, within the healthcare system?
And my doctor has never asked me what I'm eating. He's told me to lose weight, but he's not asked me what I'm eating. So I think that's actually an excellent story to check to see how widespread is that across communities, and again, how spotty is it? Another aspect of this is economics, and we've got two macroeconomic factors going on right now. One of them is inflation, and one of them is COVID-induced supply chain disruption. Alejandro, talk a little bit about how those two economic factors figure into the access question.
Yeah, no, inflation is a big one right now. Like, right, we keep seeing headlines about it. And I think the stat from the Consumer Price Index right now on inflation on food prices is about 12% higher compared to last year. And, you know, it's the case that low-income households usually spend a greater chunk of their income on food than other households bringing in more money. And which is not to say that, you know, those households can't feel the effect of inflation if you're a bit more well off. But, you know, if you're a family living near or at the poverty line and you can't afford that food, you know, it boils down to, you know, it becomes a matter of maybe, you know, not being able to afford or buy that one medicine that you need, or getting, you know, behind on bills. And, you know, that's a real issue. You know, when it comes to access, that's a very real thing. And then, you know, the other thing when it comes to COVID-inspired supply chain issues, that, of course, like it hasn't stopped. You know, you got small businesses, school districts, and food pantries that are feeling that effect. Like right now, it is a very real concern from food nutrition directors from several school districts that I've spoken to, that a lot of districts, even though the federal government increased how much schools get reimbursed for their meals to feed their kids, they are still feeling the effects of high prices. And when school districts can't afford some of those foods, it becomes a question of like what kind of food are they going to give their kids? And if you're a school district that maybe does not get enough money, what do you do? And then, the other thing is food pantries. Food pantries, I know for pantries that are members of the Feeding America network, they receive a lot of food through it's called TFAP. It's like the emergency something. I don't know the acronym. Federal government loves acronyms, but they receive food through these trucks. But because the USDA, which controls this program, has not been able to buy a lot of these foods, a lot of food banks right now have been missing these federal food trucks, and so they're going without food. And so what does that mean for people who need this right now? So yeah, there's a lot of really big implications that are going right now economically that both affect the person and the organizations institutions trying to address some of these food issues.
Exactly. I want to kind of switch up the conversation now. We've been talking a little bit from the sort of supplier side, and I want to focus now on the consumers who are experiencing this lack of access. I just remember very clearly from when I was working on the Barren Mile, you're talking to people who are at a very vulnerable point in their lives. Some may have lost a job during COVID. Some may have lost a loved one and lost a job. So I want to talk a little bit about the implications of that for us as journalists. And, we need authentic voices, but at the same time, we have to not be exploitive. So I'm going to start with Alejandro and Bridget. Talk a little bit about finding people, but then also approaching them with empathy and being sensitive to that. Bridget goes first. Bridget goes first.
Thanks. Sure. I mean, yes, Karen, I think that's just, this constant tension, right, of needing to make, these stories accessible to make sure that people who are experiencing this firsthand, are sharing their perspectives and having, an outlet for, talking about what works and what doesn't for them. But I think that, that it requires a different level of, ethical engagement, I think, than dealing with people who, maybe public figures and are used to speaking with the media. They understand the implications. I think that, especially because, well, I should step back and say, obviously there should be, and there is no shame in, experiencing hunger. Like, it is a very, very common experience. And so, yes, if we only all knew, how common it is among people that we might not ever, have expected to struggle, things might be a lot different in this arena. But I think that, when we're asking people to talk about something that they're struggling with, there is shame often there. There is the opportunity for a lot of judgment. I think that, some people that I've spoken with who have talked to other reporters have felt like reporters asked them questions that felt very sort of judgmental. I just think that we need to think a little bit about like how we would feel if someone was scrutinizing our every choice and trying to point out, ways in which we had sort of failed to take personal responsibility for, our own situation. I guess a couple other thoughts on that, I think just, having some humility when we approach people. I think trying to engage with people, not just as someone who can like share like a quote, but, like bring their whole selves to the story. So, there is not like a perfect, like deserving, person that we should put in our stories. And I think that like there can sometimes be like a almost well-meaning impulse to sort of like sanitize people's situations in this way that makes it seem like they're like this, like they deserve, help, which implies that other people don't. So I think, like I heard from, I remember, there was this one person that I interviewed who was using some of the extra food stamp benefits to like do things like buy special treats for her kids occasionally, and I put that in the story because, like, on one hand, I think people could say like, oh, you're using federal dollars to buy, popsicles for your children. But on the other hand, like, that's a really human thing, like to be able to like have like sort of moments of joy and connection with your kids that like, those of us who don't struggle with food insecurity, like don't really have to sweat, So I think, yeah. I think also kind of like how trying to paint, a portrait of someone that's three-dimensional, I guess, not just kind of like collapse them down to like this person in the line at a food bank. One other thing, I think like taking extra care, like, probably we're all on the internet like way too much, and we understand how ugly people can get on the internet. But I think it's really important to prepare people for the fact that there may be, really terrible, ignorant comments made about them, and that, that their name may be, attached to this story for lots of time, and maybe that is not going to be always a thing that they feel great about. So they need to think through the implications, and I think also checking in with folks afterward, and kind of trying to maintain a relationship, I think can be really important so that it doesn't feel like this sort of transactional, relationship.
Mm-hmm. Alejandro, how beyond the food line, what are some tips in terms of finding people? And as they're talking and revealing very personal things about themselves, do we protect them from what they're saying? Do we sort of not print things that we think might have a negative repercussion for them?
That's a good question.
Thank you.
So yeah, no, when it comes to protecting them, I mean, I think it just depends on the context of the story and how necessary it is to include, whatever information it is that they're telling you about, right? I mean, yeah, if someone's being really vulnerable to you, and when it comes as a reporter, it boils down to judgment and, including in the story what you think is necessary, and anything else, like if you're revealing something that's very personal from someone and it's not necessary, why include that? So I'm not sure that answers your question, but when it comes to finding people, since I've been here in Dayton, I've really tried very hard to build relationships with the organizations that directly serve a lot of people who, it could be your food pantries, your community kitchens. And I keep in touch with them. And, what I've done is if I ever need a story where I'm like, hey, I need to talk to someone because, maybe there's one thing that's going on. Maybe I remember, this is last year, there was there's this organization here in Ohio that if you're a retailer and you partner with them, you can basically double your SNAP benefits. They call them produce perks or double bucks. And I was like, well, this is a really cool little program. And I went up to this nonprofit that has a mobile, it's a mobile supermarket, like it's a market on a truck. And they are participating in this program of double bucks. And really how it works is if you're on SNAP and you buy food, they'll double your money up to like $20, I think. And you can spend that money on fresh produce. And I was like, oh, this is really neat. But I need to talk to someone about this, who's on SNAP and, is willing to share what this means for them. And so I did just that because I've already had that relationship with that nonprofit. I just asked them, I was like, hey, I'm looking to talk to someone about this. And easily enough, the people that work at this mobile market, they know the people that they serve and they trust them, right? And this nonprofit trusts me because I had already talked to them and reported to them, I've reported on them before. And they ended up finding me this woman who she was on Snap and she used to use double bucks program. And I just asked her, like, hey, what does this mean to you to be able to not only afford your food, but get extra, dollars to be able to afford that one, that fruit or those vegetables that you have. And like Bridget said, it does require, a form of humility and trust. So yeah, that's what's worked for me, really, just building relationships with the organizations and agencies, like working directly with these communities, and after that, I think, once you have that trust, it's, I guess, a little bit easier, but not super easy, but just it gets easier.
So building that rapport, building the rapport with the community organizations is crucial.
Yes, absolutely.
Okay, all right.
I just wanted to jump in and say I think there's a really important conversation about vulnerability. There's also, I think there's this tendency from reporters to kind of view people as like, oh shoot, I've talked to all the real experts, right? I've talked to the organizations and the PhDs and all these things, and now I need to find a real person to kind of highlight it, as opposed to, your best experts in any of these issues are people who are experiencing it, right? They are the experts in this. And so treating them kind of going into the interview, being fully aware of the power dynamics and, making sure that you're doing all the things to be as transparent and ethical in these conversations as possible, but also going into it saying, I need you to explain to me how this goes, right? Like they are the experts and they can tell you every bump in the system. And I think with things as complex as food insecurity, we often get, well, these are these high complex issues that are like so kind of wonky and abstract, but they know them in and out, right? They know the problem when they're getting a box of food, but they're living in a motel and like everything needs to be heated up in a microwave and they don't have a microwave, right? Like they understand all the places in which these super complex systems do or don't work. And so viewing the people experiencing them as the experts, as much as people who, spend their life studying this kind of in an academic policy way, has been really helpful to kind of rethink the story through, they're not just this add-on bonus if you get a real person, but are an absolutely essential part to understanding how this works in practice.
Exactly, not just an anecdote for the lead, but a source that's, I want to leave some time for Q&A, but we've had a couple questions for people asking for some story ideas. So we're going to do a really quick lightning round and go through and let's really quickly talk about some non-obvious food insecurity stories. Alejandro.
Yeah, so I think I got two, or maybe it's just one, but two different angles. So yeah, food insecurity and education, or food access and education. Right now, the big talk is free school meals, right? A lot of those waivers, schools lost them. And if the school does not already receive free meals through a program called the Community Eligibility Provision, then they're going back to free and reduced lunch. So a really interesting story to cover right now is covering how are schools dealing with going back to having to process the free and reduced lunch paperwork, and also how are parents, who didn't have to pay for school, dealing with this? Are they have, sometimes you have to shell out like $70 a month for your kid to eat at school. So no, it adds up. It's like, $2 or $3, even $5 a day, right? And then the other one is going in line with the loss of these free school meals in some schools is figuring out or reporting on the impact that free meals had on children. I mean, I think there's this very interesting correlation between food and education, where if you're worried about being hungry or you really learning. So I think it's be interesting to explore, talking to a teachers association or teachers themselves, how they've noticed any difference, if at all, since these free meal waivers have disappeared.
Excellent, excellent idea. Lauren.
Yeah, so I have found a lot of surprising kind of sneaky ways into food insecurity reporting through housing and homelessness. I spent a lot of time while I was in Ohio writing about lead paint poisoning. And, that's a real estate issue, that's a housing issue, that's a, health issue, but it's a food issue in the sense that when you learn that, we've eradicated lead paint in a huge swath of our community, but the places where it remains tend to be single family homes that are in neighborhoods that are predominantly Black and low income, they're rental housing. So you're already dealing with a vulnerable population of people. Then you add on the fact that lead is better absorbed in the body if you have other nutritional deficits. If you are iron deficient and are not getting everything you need already, that lead kind of sticks. That's a very imprecise medical term, but stays in your body and gets absorbed in the places where if you had all of your nutrients as a child, it wouldn't necessarily hang around as long. So that's a food insecurity issue, right? Like it starts as a policy issue or a housing issue, but maybe we look at it through a food lens. Similarly, I mentioned earlier, during the pandemic, you write a lot about evictions. You write about folks getting pushed into motels after an eviction and they can't find anything else. And I heard from people all the time that one of their biggest concerns with the motel was not that, they're cramped in space or that there's nowhere for their kids to play, although those are serious issues. But they said, I can't shop, I can't store food, I have a mini fridge, I can't prepare food for my kids, I can't buy in bulk the way they're telling us to during the pandemic to save grocery shopping, because where do I put it in this single room motel? And so it starts as a housing story and becomes a food story quite quickly. And I think no matter what beat you're on, like you can get to food pretty quickly.
All roads lead to food. Bridget.
Yeah, I mean, those are great ideas. I think, one more to add would be looking at wages. I mean, if you look at like the Biden administration's, roadmap to end hunger, one of the key, key recommendations is raising the minimum wage to $15 an hour. And I think that looking at what, low wages, how low wage workers are experiencing food insecurity, how they're making ends meet is really important. And I think, so we need to look at like the farm workers, others in the community that maybe we don't necessarily think about, certainly daycare workers, home health aides, people who work at food banks. Like there's a whole bunch of, folks who aren't earning enough to live in a lot of cases. So, and I think, it is really important. I think like if DoorDash says it's going to start delivering into low income neighborhoods, like, okay, is DoorDash, are drivers for DoorDash considered employees or contractors? How much are they making? I think also, we've seen like in the past, Walmart had, wanted to move into places that were considered quote unquote food deserts. And that was part of their marketing strategy. But, okay, but what percentage of Walmart workers are receiving public benefits because they don't make the wages they need to feed themselves? So I definitely think looking at low wage workers is an important piece of this.
And crucial to access, because, one of the pillars of access is that it has to be affordable. If you don't have the wages to back it up, then it's not going to be affordable. Okay, I'm going to do two real quick and then go. One of mine is looking at the city's role in trying to lure some of these traditional grocers. Number one, in the contracts that they are agreeing to give tax abatements or whatever, are they including anything in there about minority suppliers, particularly Black farmers who traditionally have complained about the inability to make any headway with traditional grocers, and that would be a way to funnel money back into the community. And then number two, a lot of these contracts are written in such a way that you get 10 years worth of abatement, and literally we've had a number of instances where on the 10th year and the first day they're out of here. our city's looking at writing some of these contracts so that there will be something with more legs. Once the 10-year tax abatement is done, do they get to just sort of pick up and run, or are there any requirements? So those are two things that I thought of. And we have two questions from our listeners. How helpful are expansions in SNAP and WIC if the recipients don't have access to a grocery store that offers eligible foods? Who wants to take that one?
I mean, I definitely can. I think that especially for WIC, where, it's a very specific set of foods that folks can choose from, like that would be a big barrier. SNAP, you can use on, anything but prepared foods. But certainly, some smaller stores may be more expensive than a large grocery store. So, if you need to travel really far to get to a large grocery store, your money might technically go further there, but you're paying for transportation and just the time investment of getting yourself there. So I mean, they're definitely they are linked questions. I think that also that's a big question around the expansion of food delivery is or like online grocery delivery, which, you can use WIC and SNAP benefits more than you used to be able to online, but you can't use SNAP benefits to cover delivery fees or tips and things like that. So figuring out how to make that access equitable is important too.
And I know that there have been some restrictions on what you can buy in terms of hot food or prepared foods with those government benefits. And so that's something that, recipients are going to have to navigate also. Let's see, hang on a second. Okay. I think we kind of touched on this a little bit, but there's someone in a small newsroom and they are looking for something that they can do without having to spend months on it. And I think that we've talked about some things that can be done, fairly quickly. Any others come to mind that we didn't have time to talk about already?
I mean, I'll just say that I have been in daily beat work up until 3 months ago, right, for my whole career. And so you're used to kind of thinking on shorter timescales. And the things that have been most helpful for me is taking the kind of traditional way of daily reporting of, oh, there's an event, right? And they kind of mention that they're trying to fill a need, right? And maybe we flip the framing of the story, even if it's half a day slower, to say, instead of leading with, they open the food pantry, right? Maybe we find a person, maybe we just kind of reframe the stories that are already there and we're spending our time on in a way that asks questions to get at, trends, issues of equity, access, things like that, that are not these kind of fully separate, different from what we're already doing, but thinking in it with hunger and equity issues as a lens. So you're not fully restarting work that you wouldn't already be doing, but just kind of taking a different look at it for the stuff that you already know is happening in your community.
Mm-hmm. Okay, all right. Here's a good question. How can I make the best case to my editors, directors that food insecurity is the story, not just part of a feel-good feature? I want to be proactive, but I feel like I face barriers. One of the things that I think we've tried to highlight here is that food access, food insecurity, it's a social justice issue. It's a human rights issue. It's a political issue. It's a business story. It's a transportation story. It's an education story. And so I think, having been an editor myself, I think, there's so many compelling angles to the story that I think, really all you need to do is make a few phone calls again to some of the community-based organizations that Alejandro was talking about. They they have a wealth of stories and they feel like nobody ever calls them and nobody ever talks to them. So I think the framing of it is beyond just the feel good. I think it's so clear that there are so many other repercussions from food insecurity, from just a healthcare cost standpoint for people who are showing up at the county-owned hospital with advanced cases of chronic illness, partly due to very poor diet, very poor healthy food access. So I think that there are so many different angles to take it from, and I'm sure that you're a very talented writer, and so I want to know how you do when you when you pitch all these stories to your editor. As PR professionals, how do I effectively show the importance of these stories to busy newsrooms? How do we make it easy but impactful to cover an important story? Do you guys want to jump into that one? If not, I can take it. I think it's very similar to what we've been talking about, though. I think because in the past, it has been framed so narrowly as there's no grocery store here, that I think there's a lot of education throughout newsrooms that this is such a bigger issue. But so how can PR people make the pitch more appealing to newsrooms?
Well, I'm not sure what setting this PR person is working in, but I think that one thing that can be useful, like if you're a community organization, is to work with a few folks who, are, part of your organization or come to your food pantry or whatever, take part in your services, and that are interested in speaking to the media and kind of working with them to prepare them to talk about their situations, to be available for reporters, things like that. That can be really great. If you're doing PR for a nonprofit or something, to have a few people who are willing to share stories about certain elements of this with reporters.
Well, I'm just getting the high sign from my director, and I could literally talk about this all day, and my friends and family who've been listening to me yammer on about it can attest to this. So I think that our contact information was in the chat, but I think I'm the only Karen Robinson Jacobs out there. So anybody that's got any more questions, feel free to message us, reach out to us. And again, I want to thank my panelists. I think you guys were fantastic. I learned so much just from hanging out with you guys, and I really appreciate it. And I'm late, so I'm going to toss it back to Beth.
Thank you so much, Karen, and thank you, Alejandro, Bridget, and Lauren. This hour really has flown by, and I feel like we're all smarter because of the discussion. And what Karen said earlier is true. All roads lead to food. So we have a lot of work ahead of us. This has been an hour full of great advice and really has provided a foundation for covering this critical issue. We really appreciate each of you. And we want to thank our participants in the audience for being here and all of your great questions. We will send a follow-up email with the video recording from this program, as well as the resources that we've linked in the chat. I hope you all stay well, and we hope to see you again soon. Thanks so much.
Thank you so much. Thank you, guys. Thank you so much.